So today we'll be knowing up what about the CAR test, which we do routinely in our labs and all. What is the basic principle and how does they function off? Okay. So before telling you about the CAR test and all, I'd like to tell you regarding some antigen antibody interaction, which is also a favorite question in the second year, which they ask up in the exam. So antigen and antibody, as you can see up here, the antigen and antibody, they interact up in three zones. Three zones, which zones? That is zone of equivalence, one is pro zone and one is post zone. Okay. So most of the reactions, as it is written down also, they happen in the zone of what? Equivalence. Why it happens in the zone of equivalence? Because the best lattice is produced in the zone of equivalence. The best lattice is produced in the zone of equivalence, and this happens when the antigen is equal to the antibody in concentration. Okay, when the antigen is equal to the antibody in concentration, then only this zone of equivalence happens, and that's why the best lattice forms, and thereby we could able to see a proper reaction because of that. Is it fine? So besides this, two other zones are also there. One is termed as post zone and one is termed as prozone. Prozone, this also is a viva question. What is prozone? Prozone is antibody axis and post zone is antigen axis. Okay, what is post zone? Antigen axis. So there are certain diseases in which prozone phenomena happens. Okay, कुछ ऐसे डिजीजेस है जिनमें क्या होता है प्रोजोन फिनोमेना एंड प्रोजोन फिनोमेना क्या होता है व्हाट इज प्रोजोन फिनोमेना द एंटीबॉडी एक्सिस मींस इन दिस डिजीज व्हाट इज प्रोड्यूस मोर एंटीबॉडीज एंड देयर इज वन फिनोमेना टर्म्ड एज पोस्ट जोन in which what is produced more the antigens are produced more. Okay, so whenever this type of situation happens that something is in the pro zone and post zone area, you need to change them into which particular zone, that is termed as zone of equivalence. Okay, how you will change? You will do the dilution. Okay, what you will do, guys? Dilution. And when you dilute the sample with normal saline and all, what will happen? This zone of equivalence will be achieved. And why we want to bring them into zone of equivalence? क्यों लाना चाहते हैं हम zone of equivalence में? Because the best lattice is produced in the zone of equivalence. Because reaction होता ही किस zone में है? That is in the zone of equivalence. Best lattice is produced in the zone of equivalence. Is it fine? So this particular thing should be clear in your mind that most of the reactions, they happen in the zone of equivalence. And if at all a particular state is such in which there is an antibody axis or antigen axis, then you need to bring it to what? The zone of equivalence. How you will bring that? By dilution. Is it fine? So this is what is there. And in serology, remember one thing, that everything is what? Antigen antibody interaction. Whenever the antigen antibody is being talked about, their interaction is being talked about, you should think for what? Serological reactions. Serology means antigen antibody interaction. Okay. Now, after this understanding of antigen antibody and all, namely two types of reactions are there. One is precipitation and one is agglutination. Precipitation is, in this we use soluble antigen, and this soluble antigen mixes with the antibody and they produce what, guys? Insoluble precipitate. Okay, and even these, they come in the form of what? CAR test. Like previously they used to use what? Ascoli's thermoprecipitation test, and that is done for what? That is done for the anthrax antigen. That is done for what? Anthrax antigen. So it is also this Ascoli's thermoprecipitation test. It was a CAR test. Okay, and precipitation, why are we calling it precipitation? Because in this, what is produced, guys? A insoluble precipitate. So insoluble precipitate is not easy to see. That's why these methods are obsolete now. Nobody does them. Okay. Flocculation is still done, and flocculation is a modification of precipitation only. What is flocculation? It's a modification of precipitation only. And the typical example is what, guys? VDRL, Venereal Disease Research Lab, which is being done for syphilis. Okay, which is being done for syphilis. And this is a slide flocculation test. It is a slide flocculation test. Okay, VDRL. And it is a slide calculation test. It can be visualized proper. It can be visualized proper on a slide. So that's why it is termed a slide calculation test. Why I'm telling this? Because they was like forms the basis. Okay. So another, in this particular thing we use slide. Okay, that is slide calculation test. But the other entity which is same like that is termed as RPR. What is RPR? Rapid plasma reagent. Okay. And rapid plasma reagent, this particular test is similar to the VDRL. And important is, in this, we use the cards. Okay, ready-made cards are available for this particular one, and they give a instant results. So that's the use of the card test. Okay, so basically, using this flocculation methods also, we can produce certain card test. Like one of them, I already told you, RPR. Now, guys, there is one more thing which is termed as agglutination. Okay, that is termed as agglutination. And what is agglutination? Agglutination is insoluble antigen when mixes with antibody, and this produce what? This produce clumps. And these particular clumps, they are visualized to the eyes proper. Okay, precipitation was what, guys? In which precipitate was formed, and precipitate is not able to visualize proper. That's why they have become obsolete. Okay, but even though we do the flocculation test, and that is RPR and VDRL stuff. But this one, in which you use insoluble antigen with antibody, it leads to the formation of what? Clumps. And these particular clumps, they are visualized to the eyes proper. And that's why we say agglutination is far, far better than the precipitation. Agglutination is far, far better than the precipitation. And there are certain tests, like which I tell you, which are known as passive latex agglutination test. And guys, what is passive latex agglutination test? They were previously precipitation, but now you have changed them to agglutination. And how you have changed them and why you need to change them? क्यों बदलना है? Because agglutination are better test. They are better visualized. And how you change them? You have to do one thing. That soluble antigen is there. You have to add up what? A latex particle. And when you add the latex particle, it will change into what? Insoluble antigen. It will change into what? Insoluble antigen. And this particular insoluble antigen will be giving what? Clumps. And clumps are visualized proper. So this is what is the basis of these card tests, passive latex agglutination test. And what is the basis and what is the examples of them? Examples are CRP, C-reactive protein, which we use for the inflammatory conditions. Then we have rheumatoid factor test. Rheumatoid factor test, that is one of them, which is in the form of latex agglutination. And even in this, you can have ASO test. And what is ASO? That is anti-streptolizin O test. Anti-streptolizin O test. So that is also there. So these three are the typical example of what? Passive latex agglutination test. And what is the meaning of them? Previously, they were precipitation, but you have changed them into what? Agglutination. Why you have changed them? Because they are better visualized. Okay. And how you have changed them? By adding up a latex particle. So I suppose this particular portion is also clear regarding the card test. Now coming to the final part here, that the card test, rapid card test, we are talking in specific. Rapid card test, they are also termed as immunochromatographic test. Okay. So the first question of your viva is that these immunochromatographic test or card test, they are based on which principle? So principle is in the name only. Immuno, I just told you, whenever immuno is being talked about, serology is being talked about, what we should think? Antigen antibody. So immuno, antigen antibody interaction, chromato on a paper. Chromato means, chromato as such means what? Color. And there is one particular thing known as graphic. And graphy means what, guys? Paper. So immuno means antigen or antibody. They produce colors while moving on a paper. And which paper we use here? Nitrocellulose paper. Okay, which particular paper we use here? Nitrocellulose paper. And the typical example is what? HEPA card. Okay. So in our day-to-day life, we use up a lot of card tests. Like if somebody asks you regarding the examples and all, so one of the example is HEPA card only. As you can see, the test become positive in this HEPA card when which particular antigen is present? HBsAg is present. And HBsAg is what? The surface antigen. Okay. And one more thing, guys, that in the card test, always what should be positive? Control. And if control is negative, then that particular card test you should not use. That is not valid. Okay. So card test control should always come positive. It should not be negative. If it is coming negative, that card is not valid. Okay. So guys, simple. Immuno means antigen antibody interaction. Chromato means color. Graphy means paper. On a nitrocellulose paper, they move by the chromatographic action. And because of this particular action, capillary action they have in this particular one, they produce bands. Like suppose you can see these are the card tests. As you can see in this picture also, these are the card tests. HEPA card. There is a control line here. This is control line and this is the test line. Okay. And in this side, you put the sample. In this side, you put the sample and it travels on this particular paper. So this is what is the immunochromatography. And as I told you, control will always come what? Positive. Here also. In the first one, the test line is also coming positive. In this, the test line is not coming positive. Means in the second card, the person is not positive. Whereas here, the person is positive. Okay. Some routine examples of this card test. Some routine examples are pregnancy card test. Okay. Which is being used by us, UPT, urine pregnancy card test. They all are examples of what? This immunochromatographic principle test. So pregnancy card test. Other than that, those dengue card test, which targets of the NS1 antigen and all. Okay. Other than this, the COVID card test, they are also there. Other than this, malaria card test for the Plasmodium falciparum, Plasmodium ovale, Plasmodium malariae. So that is also there, malaria card test. Then other than this, what we have like troponin card test, they have also come nowadays. Okay, troponin card test. As we just have done HEPA card, that is also one of the card test and all. Then IgM typhi dot card test. So these are the various tests which you need to remember regarding the immunochromatography. Okay, and they are routinely being used in our labs also. And you should know a basic principle that control should always be positive. If control is not coming positive, then your results are not valid. Okay. And that is simple. Immuno means antigen antibody. Chromato means color. Graphy means paper. Okay. So if you write up this much also in your exam, then basically the most of the reaction they happen in antigen antibody interaction, they mostly happens in zone of equivalence. Two main reactions are there, precipitation and agglutination. Precipitation, the typical example is flocculation, which is being used nowadays, that is VDRL or RPR. Other than that, you have the agglutination one. And in the agglutination one, what we have? In the agglutination one, we have those particular insoluble antigens with mixes antibody to produce what? Clumps, and clumps are visualized proper. And these particular are based on the same principle, that is antigen antibody interactions. They travel upon on this particular paper. The sample travels upon on this particular paper, and the control of this particular card, they always should be coming positive because it is being tagged with the required antibodies or antigen in such a way that it will be positive even if you run the water also. So this is what is the basis of the various card tests. I suppose you have understood. And this is a question also, the second one, 2 marks or 3 marks question. So you can answer up proper. So thank you.